Hi, I'm Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast, and enjoy the show.
Welcome to Health Futures. I'm proud to have here in the studio with me Dr. Dani Cabral. She's a person I met very recently and has become my new friend. And I'm really excited about having, can I call you Dani?
Oh, yeah.
I'm really excited about having Dani on Health Futures. So Dr. Dani Cabral, welcome to Health Futures.
Thank you. Thanks for having me. It's an honor.
It's so great to have you too, and you are doing a podcast yourself, so I want to put this disclaimer out that our podcast together may air before this one that we're doing today together, but I felt it was only right for my Health Futures audience, which we've been on the air now for 13 years, to be able to get a chance to meet you. And, you know, very few times do I ever come across somebody that has, you know, multiple board certifications. So you're a neurologist and a psychiatrist. So I would love to learn a little bit about you. I could read your bio, but want to learn a little bit about your background and really what led you to both of these fields and what you do today. And maybe fill me in on where you're from. You're probably not from Arizona like most of us are.
Yeah. Well, thanks for having me, first of all. Thank you for all that you've done and you keep doing, and it seems like you're doing more and more every year, so as far as I know, so that's really exciting.
Well, I try. Thank you.
Right, so I did a combined residency after medical school in neurology and psychiatry. And so a lot of people do one residency and then a fellowship, so they may have multiple board certifications, but I did both, always knowing that I love working with older people. And I specifically wanted to get into the space of Alzheimer's disease, Lewy body disease, and cognitive changes in aging. And so before I selected my residency and I was in training, I would see that neurologists, when they would be with families going through this in patients, they would sometimes, or maybe more often than not ask about the emotional, psychological impacts to the person, to the family member, even though it was clear in the room that this was huge, and maybe usually the biggest issues were in that space, and the mood changes and things like that. And then when I'd sit with a psychiatrist and shadow them, they didn't always look at the brain MRI and think, or at least discuss all the possible biologic causes and how to do a comprehensive diagnostic evaluation to really drive medications and prognosis. And so I thought, I'll just do it all and try to cover all the bases. And I've always liked to find the borders and combine things and overlap things. And even in undergrad, I did international studies. And so that was multidisciplinary. And I don't know if I'm just non-committal or something, but in any case, I like to think about how can we find a bridge between these different fields. And, you know, neurology and psychiatry used to be together in medicine, and then they got separated. So trying to bring them back.
Bring it back, and you did. And I asked you a question. Where are you from originally?
Oh, okay. I'm from Massachusetts.
Okay.
I'm from Webster, Massachusetts, or I call it Webster.
Webster?
Which is in Worcester County.
I know Worcester.
Yeah, right.
Holy Cross.
Right. Yeah, awesome.
And you got your undergraduate degree. I think I remember you went to Harvard Medical. Would you tell me a little bit?
Yeah, so I went to Vassar College.
Vassar?
And I did international studies.
Poughkeepsie, right?
Yeah, Poughkeepsie, New York, right. Yeah. And then I did a post-bachelor's program in pre-med at Harvard while I was working as a research assistant there at Brigham and Women's. Then I went to medical school at U of A. Go Wildcats.
Yeah.
I was in the first class of the Phoenix campus of the U of A, which was amazing. And we had 24 students.
Everything was new.
Everything was new, except we were in the old Phoenix Union High School building still.
I remember that, yeah.
Now there's the whole biomedical campus. It's so wild how much it's exploded.
Incredible.
That was really amazing. That was when we still all went to class every day. Yeah.
And you got both your degrees there?
So that was med school, U of A. And then I went to Brown University residency program and fellowship in Providence, Rhode Island.
Nice.
And then I came back here to Arizona.
And I know you were at Banner Alzheimer's. Is that where you first landed, or?
Yes. I was connected. I've been connected with Banner Alzheimer's since 2005, since I moved to Arizona originally. So I met Pierre Theriault and Eric Ryman when they were building Banner Alzheimer's Institute, and then connected to Dr. Marwan Sabah in med school and did a program with him, a research study, and published that as a med student. So that really gave me an amazing foundation. And then when I came back here after training, I worked at Banner Alzheimer's Institute and then Banner Sun Health Research Institute with Dr. Ali Atri and everyone over there. And they're all doing such amazing, powerful work.
Dr. Tom Beach.
Yes.
Yes.
Yep.
You know what's interesting is our lives, it's hard to believe that they didn't intersect till recently. Because I don't know if you're aware or not, but I was on the board for Banner Alzheimer's Foundation from 2007 to 2016. And I was there just after it got started. So, I'm hosting this podcast, but we've been on the radio for 13 years. And Dr. Theriault, Dr. Ryman, Dr. Sabah, Dr. Langbaum, they've all been on my, Jan Doherty, they've all been on my radio show podcast for, the last 13 years. So it's crazy that
I kept missing you.
Yeah, we kept missing one another, but here we are here together today, and I love where you're going, and I know you've launched from Banner Alzheimer's to doing something you wanted to do personally, and I'd love for you to talk a little bit about, Brain Love and what you're doing with Brain Love.
Thank you. Yes. So I got such amazing experience and clinical trial training and things at Banner. And I just kept seeing everywhere that, not just there, but everywhere, that people, patients, and families still were saying the same things, that same needs not getting met, people still feeling frequently hopeless, helpless, families, family caregivers. They do a ton at Banner, but a lot of folks still don't feel like they're getting what they need when they need it. So then I decided I'm going to start something different that's more holistic, more comprehensive, really tries to integrate the psychosocial, spiritual, relational in a way that's personalized and responsive. And so started Brain Love, which is a direct specialty care practice, medical practice, where we offer care both for the patient and then separately for the care partner.
Wow.
Yeah, it's really exciting. So as a psychiatrist, I can take care of the mental health and well-being of the care partner separately. And what's cool is that I don't only teach the care partner how to better work with and communicate with their person who has, say, Alzheimer's, but we talk about who are they, how have they changed, what are they going through, what do they need to fill their cup, and how are they going to bring those things and maintain those things in their life completely independently or as much as possible from the person. And then also how can they and their person keep, say, a strong relationship over time if they're married or adult child and parent.
That's hard. It really is. And as you know, we're in the caregiving space, and a lot of people forget about that care partner, that family caregiver. There are 63 million family members that are providing care every single day here in the United States. And I think the number is about 17 million of them are caring for someone with Alzheimer's and dementia. And I know you're very familiar because you and I have a chance to get to know one another because we're on the advisory committee for the Meaning and Hope Institute, which is Dr. Pauline Boss's work. And, that whole ambiguous loss piece is something I'm sure you see almost every day in the patients that you're working with, the family members who are doing that care. And self-care is so important. I'd love for you to maybe, double click on this and give us a little bit more information on what you're doing to help those family members, because we know the data shows that couples caring for one another, 65 and older, without assistance from the outside, whether it be a family, friend, neighbor, or even a professional home care agency like Cypress Home Care Solutions, 63% of the time the caregiver predeceases the care recipient. And that's tragic. It shouldn't be that way.
Absolutely. It is so tragic, and it's almost accepted. It's like a foregone conclusion, like this is just how it is.
Right.
People just are like, I'm just sucking it up and I'm going to try to survive. And I've always thought it doesn't have to be this way. However, as I've been in this practice, it's clear that our healthcare system is perfectly ill-suited for care partners to get any kind of real care directed at them because we're so individualistic. And when it's, say a spouse has Alzheimer's disease, oftentimes it's difficult to even get into the visit or get them to get evaluated in the first place because the practice can only listen to the patient. And so what I have found is that it's often, it's well-intentioned. The care partners are working hard, doing their best, but they feel like they're the only ones that can do it. And then they don't give themselves permission to take any kind of time off. And what I found is that even I could hand a care partner a list of the perfect resources for them and support, and even say, here's paid for hours to go do what you need to do, and your person will be taken care of. Oftentimes that care partner will go out, leave the house, but they really haven't left the house. They're still stressing, their mind's still spinning. And so I'm working on moving towards how can we help. It's really a mindset shift. And that's way easier said than done.
So I guess my question is more generational. You've been doing this for some time, and you talked about being here in Arizona and being at the very beginning of Banner Alzheimer's Institute when it first gets started by Dr. Ryman and Dr. Terrio. What's interesting is just that we're seeing a generational shift in the people we're caring for. The silence and GI generation is dying off, and there are very few left. And really, it's baby boomers that we're really starting to see and we're caring for. Do you see that same devotion, if you would, for lack of a better word? I mean, that last generation literally took in sickness and health very serious and felt like, I've got this. This is my responsibility. I'm going to care for my wife, or I'm going to care for my husband because that's what I'm supposed to do. And now here we have the baby boomer generation, which is the generation that has the highest divorce rate. A lot of people are solo aging. Have you seen a shift in the patients that you're caring for where, many of those caregivers are still resistant to getting outside help?
Yes, there has been definite changes, and I think some of this has to do with the advances in Alzheimer's diagnosis and treatment, which has opened a clear window of hope. And so maybe if we go to the younger generation, say the millennials, a lot of them are really pushing Alzheimer's prevention in terms of for themselves because they've seen a parent or grandparent go through this, and they're trying to do everything they can. Almost maybe for some to an unhealthy degree, frankly, but better having them exercise than, doing some other unhealthy things. Maybe.
Right.
Now then we have Gen X. I would say here is where individuals are not just taking what the doctor says and believing it and just thinking, okay, I'm just going to wait till I have symptoms or so there's more of looking into planning ahead financially and really knowing that our Medicare is not going to pay for our housing, right? So planning financially. So they're much, much savvier, Gen Xers are. And then I would say the young baby boomers aren't, they're also more seeking information and advocating for themselves and not just doing whatever the doctor says because unfortunately, medical professionals are some of the most naysayers against actually recommending a memory evaluation. The patients will come in, family member or someone will say, I'm having some trouble with my memory, and often the primary care might still say, this is normal. I do the same thing, especially older primary care doctors. So I would say those that are, say, 70s and older, that group is more still going along with not pushing to get the newest treatments and the care partner needs met. Hopefully that answered your question.
No, it does. I mean, it definitely, generational. And I never really thought about the younger baby boomers and the Gen X's. And And certainly, one of the things that I'm troubled with is the fact that, I get to sit in a lot of kitchens, which is usually the central nervous system of a household, or it's the family room. And I sit down and I get a chance to talk about what care looks like. And then when we get to the dollars and cents, they're like, well, doesn't Medicare pay for this? And I'm like, no, it doesn't. And they're shocked to know that. And, there's this misconception out there that Medicare is going to pay for in-home supportive care. It's going to pay for senior housing, as you mentioned. But neither of them are paid by Medicare. And we have a generation, it sounds like, because you're seeing some of this with the population that you're caring for, that is really forward-thinking about these things. Because I can tell you, a lot of the baby boomers have not. And they are not equipped financially or emotionally or physically to be able to do this type of work, which is really, really hard.
And the worst part is, I would say that the ones who wait and don't take action early and aren't proactive, they tend to have the bigger medical crises because they've waited and they haven't gotten care all along. So it's more costly. They're more quickly taken out of their home to live in a supervised living situation. So it ends up being more of a traumatic explosion and more costly.
Right.
And I was thinking recently, we have 529 plans to plan for college.
Yes.
We should have something like that to plan for how we're going to survive financially.
Oh my
like
gosh.
For housing.
Specifically. You must be like reading my mind. No, seriously, because I've talked about this, and I don't mean to be hyperbolic, but I talk about how kids today that are graduating college should be setting up a fund for long-term care.
Yeah.
We should be setting up a fund because that rainy day fund is going to be needed. And the amount of money that it costs for care in residential housing or even in-home supportive care is astronomical. And the typical American can't afford that. Wow. So, one of the things that has enamored me, and I did do some research, is that, you were very much involved in the clinical trial leadership. So you've seen a lot of the, and the crazy thing is you've been around this a long time, and you know that there hasn't been an FDA approval on a drug in like 25 years. And now all of a sudden we've got a bunch of them that have been approved. And I know, Dr. Sabah talks about this all the time. Marwan talks about, hey, you know what? This one didn't work. It failed, but we learned. And we keep learning. And, we have blood tests now. I know that there's some GLP-1 tests that are going on right now. There's a lot of stuff that is being done pharmacologically. I don't know if you want to talk a little bit about that, because you were on the ground floor working with that when you were over at the Institute.
Yeah, I feel so grateful to be in this field now, because I get to actually see positive trials, drugs approved, like you said. So we have donanemab and lecanemab. So these are anti-amyloid monoclonal antibody treatments. So just briefly, what we think is that the first hallmark of Alzheimer's changes in the brain are called amyloid plaques, and they build up starting 20 years or more before symptoms start. So in midlife, right? And so these have been studied and have been approved for early symptomatic Alzheimer's disease, which is in these what we call mild cognitive impairment or mild dementia stages. And so what we found is that these significantly slow the progression of cognitive and functional decline over the study trial period of 18 months compared to placebo. And then now in real world, these seem to continue to slow the progression compared to individuals that don't take these drugs at all. And so what we've seen, and I've seen starting in the clinical trials and moving forward, is that people hang in there, a good number of people, a lot longer than we would expect, and they maintain. And also, I would say that hope, that element of I'm doing something for myself, there's a treatment, I'm getting into my house, I'm going to get my infusions, these are infusion drugs. People often end up taking better care of themselves, staying in healthy lifestyle behaviors longer, keeping their relationships stronger, growing things, learning. It's still, my whole philosophy is that there's still opportunities for growth and transformation despite having Alzheimer's disease, cognitive impairment, or whatever, kind of neurodegenerative disease you have going on. And so now we can accurately diagnose Alzheimer's disease even with a blood test. I would say the caveat that I don't call it a simple blood test as many people do, because actually it's quite complex to give as a physician to give a diagnosis of Alzheimer's disease takes many visits and takes much time for the person and family to come to terms with it and figure out what they're going to do. So yes, I'm a fan of these medications for certain people. I prescribe them through Brain Love. There's a lot to be discussed about, the risks, potential risks, and how we monitor for those. And moving forward, we'll be able to test for other things soon enough, like the tau neurofibrillary tangles, and there will be multi or combination treatments probably within the next 5 years, targeting multiple changes in the brain for Alzheimer's, not just the amyloid. The other cool thing is that these medications that I just mentioned are now also being studied in people who are developing these brain changes but don't yet have symptoms. So we call that preclinical or at-risk asymptomatic Alzheimer's disease. So this is your person who's 55, feels fine, working, has kids, maybe taking care of aging parents, and yet has amyloid plaques developing in the brain and may go on to develop Alzheimer's symptoms. So we're going to find out early next year for one of these drugs, for lecanemab, if it does in fact slow the progression to symptoms in those people who are potentially or probably on the trajectory for that. So that's so exciting, and this leads many more people to walk toward their doctors and say, please evaluate me. I want to know really what's going on. I don't want to stick my head in the sand. And so with Brain Love, we attract people who are proactive. They want to fight for their identities and their relationships and all that they've built in the world. And so we use these medications. We use, lifestyle modifications and a lot of this, again, mindset work. Like your life is not over because you have any of these things going on.
It's interesting. Both Dr. Ryman and Dr. Terrio, when they first got started, and I know they've used this catchphrase, if you would, the way it used to be was diagnose and adios. And there's so much more today. And when I first got into the field 22 years ago, the only way you could confirm an Alzheimer's diagnosis was through an autopsy. And it's amazing what we can do today. I'm not going to say a simple blood test, but a blood test can tell you a lot. You said something before about people getting amyloids and maybe even tangles and not displaying symptoms. I've heard, and maybe I heard this incorrectly, people can have those things form in their brain but never get Alzheimer's, which is fascinating to me. And I don't know if you know why. Maybe it's because they're living a healthier lifestyle. Maybe they're predisposed to some of this. Or maybe it's still an unknown, but it's fascinating to me that people can have those traits and still live very high-functioning lives.
I think what you're describing is what is the risk equation for people who have elevated amyloid yet have no symptoms, the risk of going on to develop symptomatic Alzheimer's disease. So what are other factors that may increase that risk or decrease that risk?
Right.
And we know ApoE4 is the Alzheimer's susceptibility or risk gene.
Right.
If you're a carrier of 1 or 2 copies, it's slightly increased risk if you have 1 copy. So it's about 15% higher risk of Alzheimer's symptoms during life compared to average risk. And then if you have both copies, that's 35% higher risk. So it's not a slam dunk that you're definitely at all.
Right.
But it elevates your risk. And then there are a lot of metabolic and cardiovascular risk factors that will increase your risk. So the high blood pressure, high cholesterol, obesity, being sedentary, smoking, alcohol use, and then things like...
all the fun things.
Yeah.
No, I'm only kidding.
No, I know. And social connection, things like that. So so we know that if you have elevated amyloid alone, that certainly doesn't mean you're definitely going to go on to it. But if you have any of those other risk factors in addition, that certainly increases the chance. And age, I should mention first off, is going to increase your risk. Now, if we can identify amyloid plaques and tau tangles are present, both of those, then there's a very high probability of going on to develop symptoms. And so this is where there's been a lot of controversy. And this blood test, which many people have now heard of it, it's called p-tau 217. Many people automatically think because it says tau in it, it's a marker of tau neurofibrillary tangles, but actually it more tracks with the amyloid plaques. So we are close to having a validated tau biomarker, and it looks like we have it in the cerebrospinal fluid. That's very highly accurate and getting there in the blood, but not yet approved by Medicare. So when we have that, say you're seeing your primary care, you're 55, you get both of those blood tests. If they're both positive, then you're going to be told, okay, this is what we recommend for getting into treatment, just like when you have cancer screenings and you get the positive mammogram and you're asymptomatic, you get into some kind of
prevention study or prevention
from going on to,
Got it. So, I did some research on you, and I know you do a comprehensive evaluation when you sit down with a patient. Can you share with us what that looks like?
Yeah, it's so for the BrainLove diagnostic pathway, it's a little different than the traditional memory neurology pathway because our patients first see a neuropsychologist virtually for a brief cognitive assessment. So if you're familiar with neuropsychological evaluation in this field, it's a 4-hour-long battery of tests that's exhausting, but very valuable. But people get really anxious about it. So what I found is valuable is to have a brief assessment, and then when the person sees me, I already have a sense of, are they in the very early stages of cognitive changes or are they much farther along? And then I can tailor my evaluation to that because their needs will be quite different if they're more in the moderate to severe stages of functional
100%.
change, right? Versus very early. And so I'm asking so many questions, not only about the cognitive symptoms, but mood, sleep, neurologic things like walking, tremor, movement changes, also medical issues, medications, and lifestyle factors, resilience factors, social support. And then if I have, I really will, if at all possible, have a family member in the room and say it's the spouse. I want to hear about that relationship, how that's going, how the communication is. I even ask about intimacy. I ask about everything. And then when we go through the diagnostic tests, we have, of course, labs, making sure there's no medical issues going on, like thyroid issues, for example. And then we have imaging. So I'll want to get an MRI of the brain to see if there's shrinkage, to see if there's cardiovascular disease or cerebrovascular disease building up there, and any other surprise things. And then we'll move on to these specific changes for Alzheimer's, like if appropriate, like there's other types of brain scans or the blood test. And then I'll make a number of referrals to outside clinicians, to therapies, PT, OT, speech. And we have this is really cool and different. We have a personal trainer we work with named Parker Condit. So he specializes working with older adults. So every BrainLove member, including all the care partner members, get to meet with him for 2 sessions, and he gives them a personalized treatment plan training plan. And, mostly all of us over, even 40, I would say, have some kind of musculoskeletal issue or pain. So he works with them. And many people want to get into weight training more and resistance training, especially as we age. And there's so much more we hear in social media now about the benefits of strength training and building your muscle mass and how we lose muscle so quickly as we age, especially women. So he gives people that confidence to start doing exercises.
I love that.
Yeah, it's amazing. They love him.
No, and really, it's more than just diagnosing. It's really helping people live their best lives. And that's what I love what you're doing. I really do. You've been fighting the stigma and isolation, and you're publicly trying to phase out the D word, dementia. Can you tell us a little bit about that?
Yeah, I have always felt like the word dementia was not accurate and was causing people to, even in the visit with someone, I would say that, and you could see them shudder and shut down, right? And so how am I going to help anyone if they're totally shut down? And I happened to coincidentally connect with Mike Zindel, who started an organization, a nonprofit called the Initiative to Change the D Word. And so he's amazing and has mild cognitive impairment. He's very public about this. He has Alzheimer's disease, and he's speaking all over the world about how that word specifically stops people from getting detected, going in for early detection, evaluation, diagnosis, treatment, clinical trials. And it's so stigmatizing. It actually was coined in the 1700s as a medical diagnosis. It comes from the Latin for out of one's mind. And so you see people who are just, you say, I don't have that dementia. And I think it's actually that they're saying, you're not going to take away my identity, my strength, all that I've accomplished, my relationships, my career with this one word, because it truly does shut down your options in your life.
It doesn't describe who I am.
Yeah, no.
100%.
Right.
Well, it's interesting. I remember growing up, hearing the word demented and never made that association that it was dementia or Alzheimer's. It was just, it was kind of, a different word to use other than crazy.
Yeah.
That person's
it's
demented.
Still that way. Yeah.
So I get the stigma behind that.
And I would just add that what I've seen with patients and families over the years is sometimes people will, once they get that diagnosis, you'll see soon after they suddenly decline really quickly and there's no medical reason. And it's as though they're so discouraged that they're demoralized, they're dehumanized, and the world doesn't have adaptations for them either. So it's not warm and welcoming. And so it's this just perpetual cycle of going downward. Yeah.
And the hard thing for me is that I get a chance to be with these families and the family members talking to me about their loved one who's sitting right there and not participating, just listening. And, I often try to bring that person into the conversation because I know they're still there. I think of that movie Still Alice, right? I mean, they're still a human. They still have emotions and they may not be thinking clearly, but they do understand at times. And you want to make sure you're inclusive of them and not excluding them. And I'm sure you've seen that practice in the past. Not that you practice that way, but you've seen others practice that way.
It's pervasive still.
It's sad.
It's everywhere. And I get it. And there's also no time in the healthcare system in your primary care visit to talk to two people, honestly. Like it's two conversations, But the way I think about it is that's the nonverbal people who have these diseases in their brain are more sensitive to our energy and the nonverbal, and they can feel when you shut them out.
Whoa.
And so then they're just like, as a coping mechanism, they're like, okay, I'm just gonna be quiet because I'm not wanted there. And the specifics maybe they don't understand at that moment, but and no one. It's not too. We're all doing our best. So there's a lot of. It's a systems issue, but it's also It's also helping families, showing them how to bring them in and how not to be scared of how to talk to. As a say a medical student shadowing me can see how I am engaging with everyone and preserving dignity while getting all the information I need to help the patient and family.
Oh, I love that. So, is that the genesis of Brain Love? Tell me how you went from a big entity like Banner and started your own practice. I'm sure there's a great story there, and you just talked about how the fact that the care partner and the carer patient, it's two separate conversations, and it's hard to do in that kind of setting.
Yeah, the truth is that the healthcare system does not reimburse for most of what is needed for excellent care for people going through these and their families. So my practice is a private pay practice because we couldn't do these things if we were just
relying on reimbursement.
The hope is that someday this will be covered by insurance. And so what I say, essentially I just realized, you get to, you're in the world long enough, you're working long enough, you've seen enough and I just thought, I have so many ideas and I can't implement them in this traditional healthcare system. And it's no one's fault. It's just, it is what it is. So I need to step out of the system and be my own boss and be able to be creative, try things, and listen to the patients and families. And I've already done things that I've changed because of feedback from them. And I keep asking them, and I'm very much connected to the care partners. And they call me and email me, whether or not they're actually patients, Brain Love patients, they're still a crucial part of the care. And so I am creating this model, which I call high touch, high tech. You need both. I love AI. I'm incorporating it readily as much as possible and will continue to. But that alone will never be successful in this world. Mm-hmm. And it's partly because there's such of that sensitivity by the patients and families of, are you really in this to help me or are you just trying to make money? And it's much more tuned in than I think anyone else, any other patient population, so to speak. And so we're trying to find this balance, and we're going to demonstrate these much better outcomes in the long run, and just creating better systems that are responsive to people and families going through this.
I would imagine you were growing up, you weren't that person that was drawing in between the lines. You were going outside the lines. I just imagine that, and I love that about you. I mean, look, the traditional healthcare system's broken. It's not fixed, and we could have a whole conversation about what private equity is doing to a lot of these medical practices, and you're lucky if you get 7 minutes with a specialist or even your primary care, because they got to see so many patients, and it's hard to practice what you want to do and be helpful when you only have 7 minutes with a patient. I get that.
Yes, and it seems like you're made to be. You have to be a robot as a physician in order to stay in your job and get your, check all the boxes to meet your job requirements. But then they're saying, well, we don't need you because we can replace you with robots. So so I say, if you don't want to be replaced by a robot, don't act like a robot. But then you have to in this healthcare system. So it's this vicious cycle. And I really applaud everyone who's hanging in there and doing all the amazing work, and in the hospitals too. And so I do want to say that it's so important to keep trying to bring in that value, the real value and connection and humanism in that patient experience, because one conversation can be, and one interaction can be much more therapeutic than, tons of visits and tons of gadgets and medications.
100%.
Yeah.
So you have a thing called Tune Up with Brain Love. Can you share what that is?
Yeah. So the way I invite people in is
right.
Come get a brain tune-up.
A brain tune-up.
Because it turns out, as we age, there's so many possible causes for cognitive change or memory loss or trouble planning, organizing, word-finding difficulty, so many more causes than Alzheimer's. So what I'm doing is not just an Alzheimer's evaluation. I look at so many different things, as I mentioned before, all of those different things, and almost always, I think the fewest recommendations I've given were in 4 areas, and it's usually more like 8 or 9, and it's like let's pursue the Alzheimer's evaluation, but your sleep situation, your sleep is very dysfunctional. Your sleep hygiene, maybe you're having a little too much alcohol, maybe you're taking medications that clog up your cognition, maybe your routine is off. You may have other medical or metabolic issues at play. Stress, of course, is a huge one. Stress management. So. And the cool thing is, what I do, people start feeling better right away, and oftentimes people's cognition gets better. And even though we may ultimately diagnose Alzheimer's disease, they're feeling better, they have more energy, they're thinking better because we've addressed all of these other things. And that's something that I think I want our healthcare system to capture better, and that will be more in tune with the realities of what's happening to us.
I love how you talk about the care partners being patients too. And, we talked about that earlier, how, people just don't really think about that. They often are the person that is, left to be challenged, with their loved one and trying to care for them. I want to ask you what your view of the future is. Where do you see us going in the next 5 to 10 years? Being on the ground with the clinical trials that you have been very much a part of and still working with your patients. Mm-hmm. I know breakthroughs are happening every day. I know you don't have a crystal ball, but where do you see us going in the next 5 to 10 years? Yeah,
we're going to learn that there's so many types of diseases within Alzheimer's disease, and eventually there'll be, genetic and molecular subtyping. We'll have multimodal we'll have combination treatments, so not just one medication, but multiple that are personalized. Very excitingly, I think we'll have these lifestyle interventions baked into our treatment plans, especially in that late midlife, that maybe 55 to 65 range, because we know that cardiovascular health and metabolic health works hand in hand for better, or to help decrease the risk of Alzheimer's or to increase the risk. And so maybe we'll have, wouldn't it be great if not just like a gym membership as part of your health insurance benefits, but some kind of personalized coaching because it's what we found with the Pointer trial, which was the study of using this multimodal lifestyle intervention in people who are ages 60 to 75 who are at risk of Alzheimer's symptoms but didn't have them. So they had cardiovascular disease and they were sedentary and things like that. It was the high touch, structured coaching program for these things like exercise, diet, that those people did better than those that didn't get the high touch. And so did better, meaning they actually improved their cognition after the study period, which is amazing, right? That a lifestyle intervention could do that. And if that was a drug or a pill, that would be flying off the shelves, of course. But it's not yet. So my point is that high touch. We can't just say go to the gym and you'll get better or you'll feel better. We have to have that accountability, and that maybe at the end of the day it's about community. And so creating community is so important. And I really am optimistic that these things will start to change in the next even 3 years.
I like to think so too. And I mean, I like how you phrase that. I mean, accountability is everything, right? You as a physician, you can give your orders, if you would. Mm-hmm. You can give your prescriptions. You can tell a patient to lose weight, exercise. But then once they walk out of that office, you have no idea if they're doing that. But you have that personal trainer that you can connect people to. I mean, you put a plan together. You make them accountable. There's so many ways to be accountable today. I mean, we have wearables. We have things that are calculating on our machines. We have tests that we can take. We can do it invasive or evasive. We can do ambient testing, which is really cool. There's just so much that is there that can make our lives even better. So, like you, I am optimistic, and I definitely see the breakthroughs that are going to be forthcoming. So I want to do a rapid fire question and answer. And I didn't really prepare you, but I told you I was going to do this. So, what is your non-negotiable brain health habit on a busy day?
Ooh, move your body.
There you go. I love that. Morning, are you a coffee, tea, or neither person?
I love coffee.
Your go-to exercise and why you stick with it?
I like running around my neighborhood. It's so easy, doesn't take a lot of work or time to throw on those sneakers and just run out the door. And plus, we live in Arizona.
We do.
We can do that like any day of the year.
Is there a certain amount of time or distance that you usually go?
I think it's so important to know your stage of life. So I have school-age children, so I don't have hours to run anymore. So I just say a half hour, as many days of the week as possible.
There you go.
That's good, yeah.
One healthy eating choice you make that's surprisingly simple.
Ooh. I added smoothies to my life, and it made a big difference in regulating my, cravings for sugar otherwise. So it actually has really cut down my like dessert or like non-healthy sugar.
Smoothies. You make them at home?
Yeah, I make them at home. I just get frozen fruit, water, and some, a few other things thrown in there.
Oh, I love it.
Yeah.
I love it. What time do you try to shut things down at night and try to protect that sleep that you get? And how much sleep do you get?
Ooh, good question for me. So I would say, so I'm 47, so I'm in this, perimenopausal.
You look amazing, by the way.
Thank you. So I have been having a little bit of sleep disruption, like in that middle of the night, which is I'm sharing because a lot of people are going through that. And so I, put the kids to bed by 9, and then I do a brief meditation with the Insight Timer app. And it's very brief, actually, almost embarrassingly brief, because I'm just too tired. I know I'll just fall asleep. And so I shut things down, like screens before that, but then I try to go to bed by 9:30, basically.
Nice.
Yeah. So I personally don't need a lot of sleep right now, and I think getting, for me, 6 hours is plenty for me to feel fine the next day. Like 6 hours strung together. That sleep consolidation is so important, right?
Yeah.
But once my kids get a little older, maybe I'll hit 7 hours.
There you go. What's your favorite brain break in the middle of a stressful day?
Like something to quiet my brain?
Yeah.
Oh, just some real intentional breaths, taking some long, deep inhales and exhales.
Do you do yoga?
I don't right now.
Yeah.
Yeah, I did it a lot when I was younger, but...
It's amazing. For me, I never thought I knew how to breathe until I started doing yoga. And that's really helped me meditate. It's helped me go to sleep because I'm just really concentrating on my breath. A brain health myth you hear constantly that you'd love to retire today.
That that everything just goes downhill with age, that we should expect to just have trouble with our thinking, and that's normal. It's actually not normal. There's no more normal aging versus abnormal aging. It's really, in terms of if you're having cognitive change, it's really like get checked out, because there's probably something going on that could be addressed without medical intervention, frankly, like without medications.
The most underrated tool for families dealing with cognition changes, education, community, OT, exercise, or something else?
I would say sitting together, and that might have to be virtually, but having real, open, honest, transparent dialogue about what's going on and the fears that everyone has and the hopes, and how that family can best come together to support each other, to stay strong and to adapt as things change over time.
Okay. What's the one question you wish every adult over 50 would ask their primary care clinician?
Oh my goodness. I would ask them for a personalized physical activity prescription.
Okay, love that. And it goes back to movement.
Yes,
what
exactly.
you were saying.
Yep.
All right, so this is the last one, but there may be one after that. When you need to refill your own cup, what does joy look like for you?
Oh. Well, I have one of my core values is fun. So fun and joy goes together.
I love it.
So I just have many things that make me laugh, essentially. So, but I think getting outside and doing some kind of not necessarily exercise, but just moving around and you know what? I take it back. It's dancing.
Dancing?
Yes.
Oh, I love it.
Like just by myself at home or...
Just listen, Dick years old.
Yeah. Wow.
And he talks about that movement is the secret.
Yeah.
He goes to the grocery store and music's playing, he's dancing down the aisles, even at 100 years old.
That's amazing.
So there's a lot of truth to that. So alcohol. There's studies that say no.
Yeah.
Not even one glass of wine. Is that true? And what are your thoughts on that?
It seems to be a fact that alcohol is a toxin to our bodies, right? So, but I think just like anything, it's how you're using it, and not just how much, but it's in what context or setting. So if you're having a glass of wine with your family or group of friends at a real beautiful, meaningful dinner, as they seem to do so much better in Europe than we do. And they're laughing, and it's hours long, and there's so much food, but they don't gain weight like the same as we do.
And they pair the perfect wine with the food. Yeah.
And so being intentional, really intentional and deliberate about how you're using that's, I think, when it's, I don't want to say healthy, but in conjunction with all of these other things can be okay. But what I say to people who are having cognitive changes and aging is 1 to no drinks a day is what's recommended.
Yeah. Especially for sleep. I mean, alcohol is a big sleep disruptor for sure. Mm-hmm.
Yeah, and mood and all. Yeah, many things.
So as we wind down our podcast together, and I've so much enjoyed having you here with me, is there a question I haven't asked? Or is there a lasting thought you would like to leave our listeners before we say goodbye today?
Well, I would like to say that I feel so lucky to work with older adults because, and I'm sure you would share the same sentiment, I learn so much wisdom from people every single day. And what I see is that it's never too late to change and have a transformation or a breakthrough. And that doesn't have to be if you're having Alzheimer's disease or something. That can be in any sense. And I've heard of many people deciding at a really late age they're going to connect with some family member or some friend and, have some kind of reconciliation or have a breakthrough about something they've been grappling with their whole life. And so I want to empower people to be willing to open those doors and look at things, because that's when the real joy can be experienced.
It's interesting you mentioned about reconciliation, because I have a friend that's no longer here, but he chose after he retired to reach out to some of his friends that he used to have, and they were no longer his friends, and tried to reconcile. And he found that incredibly cathartic, and so thankful that he did. I mean, there were tears, from kids that he was friends with in high school to business associates that he took. I mean, it takes a lot of courage to be able to do that. And I forget how many people he called, but every one of them was receptive to his call, and how a weight was just lifted off his shoulders. And, there's no reason for us to be at odds with anyone. Life is just so beautiful. We only get one shot at it. We should make the most of it.
Cheers.
Dani, if people wanted to reach you at Brain Love, what's the best way for them to get a hold of you?
Yeah, I would say check out our website. It's mybrainlove.com. You can always email me at Dr. Cabral at mybrainlove.com. That's Dr. Cabral. Our practice is located in Central Phoenix at 801 West Maryland Ave. We do telehealth as well, and we have online Brain Love community, Instagram and Facebook, and then check out our my podcast called Resilient Aging Unfiltered.
Well, I'll tell you what, it's been great to have you here on Health Futures. I've learned so much more about you because I was the guest on your podcast. You're doing amazing things, and you've got, such a great mindset. You've got the heart, you've got the passion to really help families through this journey that they're dealing with. So I can't thank you enough, Dr. Dani Cabral, for being here on Health Futures. And thank you to our listeners for spending some time with us. Make it a great day. Have a great week, and we'll be back next week. Thank you, Dani.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com.